Hello, my name is Ellison, and my research topic was alcohol. According to the 2024 National Survey on Drug Use and Health, 9.7% of Americans aged 12 and older, which is approximately 27.9 million people, had alcohol use disorder in the past year. According to the South Dakota Behavioral Health Department, in 2023, 27% of South Dakota adults met the criteria for heavy or binge drinking, which is one of the highest rates of the nation. For heavy drinking, that's 8+ drinks per week for women and 15+ for men. For binge drinking, that's 4+ drinks on one occasion for women and 5+ for men. People obtain alcohol in both legal and illegal ways. For 21+, some legal ways include purchasing directly, friends or family buying for them, gifts or deliveries, or traveling to states with lower drinking ages. Some illegal ways include social hosting, which is when of-age adults provide alcohol to minors, often at parties or gatherings without charge. Bribery or shoulder tapping is when someone asks a store clerk for cash or cashier for help purchasing alcohol without paying. Using fake IDs, which is when someone obtains and presents forged or altered identification to bypass age restrictions. Parental permission. In some states, parents or guardians may legally provide alcohol to minors, though this is rare and often controversial. Theft, stealing alcohol from stores or private collections, or cross-border travel, entering countries or states with lower drinking ages to purchase alcohol. Social stratification and vulnerability to substance abuse. Social stratification affects who is more likely to struggle with substance abuse. Even though people from any income level can use drugs or alcohol, research shows that some groups are at higher risk. Those groups include low socioeconomic status or SES groups, youth and adolescents, urban migrants, isolated workers, creative professionals, and homeless and incarcerated people. Immediate effects of alcohol and why people use it. Alcohol's immediate effects begin within minutes of drinking. Some effects include relaxation or drowsiness, euphoria or giddiness, lowered inhibitions, impaired judgment, memory and or reasoning, slowed reaction time and motor coordination, changes in mood, and vision and hearing changes. People often use alcohol for social enjoyment, self-medication, impulse control reduction, or cultural or ritual use. According to the National Institute on Alcohol Abuse and Alcoholism, alcohol is addictive and can lead to alcohol use disorder, especially with repeated or heavy use. It affects the brain's reward system, increasing cravings and making it harder to stop drinking. Withdrawal symptoms such as anxiety, tremors, insomnia, and nausea can reinforce continued use over time. Intolerance builds, requiring more alcohol to achieve the same effect. Long-term health impacts and life expectancy and alcohol abuse. Chronic alcohol abuse or alcohol use disorder is associated with a significant reduction in life expectancy and widespread organ damage. Biology Insights says that alcohol dependence can shorten lifespan by about 10 to 12 years on average compared to the general population. Alcohol is not scheduled under the U.S. Controlled Substances, says Nova Recovery Center. Federal versus South Dakota laws. Federal law sets the baseline alcohol regulation in the U.S., while South Dakota law implements and enforces it locally. Federal laws include the taxation of alcohol, the interstate commerce of alcohol, production standards and labeling requirements, and permits. South Dakota state alcohol laws include legal drinking age, ages 18 to 20 exceptions, illegal drinking age, and loitering. When these laws are broken, here are some examples of penalties. For a licensee, a Class 1 misdemeanor for selling to someone under 18, a Class 2 misdemeanor for selling to someone between 18 and 20 years old, with exception. Max penalties: 1 year in jail and or a $2,000 fine for selling to under 18, or 30 days in jail and a $500 fine for selling to 18 to 20-year-olds. For clerks, it's a Class 1 misdemeanor for selling and to anyone under 18, or Class 2 for selling to anyone 18 to 20, says South Dakota Department of Revenue. Penalties for possession versus distribution of alcohol in South Dakota. For possession of alcohol, the main offense is unlawful possession or consumption. Unauthorized ingestion of a substance, including alcohol, for intoxication is a misdemeanor. Distribution of alcohol is a felony. If alcohol is distributed in violation of a liquor license or alcohol control law, for example, serving alcohol to minors in prohibited locations or without a valid license, it can be prosecuted as a Class 4 felony under South Dakota's Controlled Substance Framework, carrying up to 9 years in prison and $20,000 in fines, says Walter Law Office. Social problems linked to alcohol abuse in communities. Alcohol abuse creates widespread social problems that affects families, neighborhoods, and the population. Some problems include family and household disruption, crime and public safety, youth and their education, workplace and economic costs, health and social service strain, social stigma and inequality, and cultural and structural factors. It says easy sociology. Thank you.